Pneumothorax is the condition when air enters into pleural cavity either because of trauma or because of excess pressure on lungs. Lung as a result collapses in such a case, either partially or completely depending upon the amount of air that has gone into pleural cavity. So how it is diagnosed on a chest X-ray? Remember, in one of the previous videos we discussed that vascular markings should be visible on a normal chest X-ray. So we're talking about these blood vessels, these white ones, or opaque lines as we call them. They're tapering off and then branching off, and they're going through the lung parenchyma on both sides. So that's how a normal chest X-ray should look like. Well, in case of pneumothorax, you would not be able to see these vascular markings as in this X-ray. So this is a normal left lung, and you can see vascular markings going through the lung parenchyma, versus on right hand side this is a black area and you cannot see any vessel going through this area, and that's how you diagnose a pneumothorax. Now this is collapsed lung here, right collapsed lung. So only one lung is functional at this point in time for this patient. The right lung is collapsed, and the only way to treat this condition is to try and insert a tube into pleural cavity and try and pull that air out and try to expand that lung again. This is another chest X-ray. In this case, right lung is normal, but you can see a big pneumothorax on left side. So no vascular markings in this area. And notice that trachea is shifted towards right hand side. Heart is also pushed towards the right hand side because of extrinsic pressure from pneumothorax. This is an axial slice taken through chest with the help of a CT scan machine. This is the anterior side of the patient or front side of the patient. This is the posterior side or back side of the patient. This is the left lateral side of the patient and right lateral side of the patient. Right side, you can see vascular markings going through the lungs. Left side, this is the collapsed lung here, and this area has got pneumothorax, no vascular markings. These are ribs, and you can also see a chest tube, a tube passing through the ribs going into the pleural cavity. The lecture is prepared for www.academyofprofessionals.com. All of the X-rays have been copied from wikipedia.org. Thank you very much to the individual or organizations who have uploaded the images. Thank you very much.